Hey there, it's Dr. Linda Burke. So, the New York Times article about Woodhull Hospital has everybody talking. Most people are focused on the firing of a 72-year-old OBGYN physician. But what I want to focus on is the white coat wall of silence that basically is killing patients. And what I mean by that is hospital workers see things, but they don't say what they see because they're afraid of retaliation and losing their jobs. For example, 2020 at Woodhull Hospital in Brooklyn, same neighborhood that I grew up in, Asia Semple passed away on July 1st because of an anesthesia complication. And everyone knew that this anesthesiologist was incompetent. 5 cases before Shah-Asia's death, 5 women almost lost their lives, okay? It was so egregious that the nursing staff would purposely tell patients not to get an epidural when this doctor was on call. In 2021, they fired him. He was originally from Russia. He couldn't find a job. He was basically blacklisted throughout the medical community, so he returned to Russia after living in this country for about 25 years. Fast forward to 2022, 2 patients die at Woodhull Hospital within 2 weeks. The first case involved a woman who had a previous cesarean section. She tried to have a vaginal birth after a section, and that's okay if the conditions are correct. But in her case, the conditions weren't correct. There were midwives who had allowed this patient to remain in labor for 24 hours. Although she was a VBAC, she had an incision on her uterus. I guess because they were so adamant about having a vaginal delivery, and it's nuts and it's wrong, okay? So at the 11th hour, they call Dr. Daniels to come in. He alleges that he didn't know anything about this patient. The incision burst, okay, because of the constant contractions of the uterus. Unfortunately, this newborn child died. And on top of that, the mother lost her fertility because she had to have a cesarean hysterectomy in order to save her life, because she would have probably bled to death if she didn't. 2 weeks later, same labor room, there is a patient allegedly who has fetal distress. And fetal distress basically means that the baby's heart rate is dropping and it is saying, "You have to deliver me. I cannot survive in this uterine condition. The conditions are incompatible with my life. Please come get me." That's what fetal distress means. They can talk about oxygenation, et cetera, et cetera. Basically, fetal distress means it's time for the baby to be born, okay? That did not happen in a timely manner. Allegedly, they called Dr. Daniels at the 11th hour, and he did a stat C-section, meaning that it's an emergency C-section. He was assisted by someone else, and I'll get back to that in a minute. After the section, patient went into the recovery room and died. In Dr. Daniels' op report, he mentions nothing about the complications. Now, allegedly he thought that he had corrected the problem, but he never mentioned the complication in the op report. So, as a result of the regulators threatening to shut down Woodhull Hospital and basically create another maternal desert in a Black and brown community, Woodhull pulled up, fired Dr. Daniels, put the 2 or how many midwives were involved, put the midwives in a monitoring program to make sure that they, were clinically competent, and started doing OB simulations, basically practice drills of emergency situations and non-emergency times so that they could remain open. Here's the problem I have. There are people who work in hospitals. You see things that are wrong, but you do not open your mouth for fear of retaliation and losing your job. I get that. But when you do that, when you have this code of silence, innocent people die. And so in addition to us talking about racism as a cause of maternal death, hospital workers who do not open up their mouths when they see something wrong are just as guilty. Now, let me tell you something. I know what it is to have to report something wrong. During my practice, I had a medical director who was sexually abusing patients, and I had to report him. I was scared, yes, but I had to report him. And I did not have a job to step into if they fired me. They didn't fire me, but I left based on the pressure. But I felt good knowing that at least this man who lost his license would never have the opportunity to sexually abuse patients again. So in conclusion, all right, if we talk about correcting maternal health issues, reversing maternal death, reducing the numbers, then we have to create two things. We have to create a culture of accountability where people who mess up are held accountable. You don't necessarily have to lose your job, but you have to improve your skills and your decision making. The other thing we have to do is create a culture of transparency and safety so that hospital workers, even if they complain anonymously, they see something, they save something, and when you do that, you save a life. As always, I thank you so much for listening. Please share this video if you found it helpful. Like and subscribe my channel so that I can continue to do what I do, which is try to empower people in terms of knowledge. Take care. I'll see you next time.